everyone. We are Team Trancendence, and what we decided to work on was solving the healthcare crisis in this country. So we'd like to open up with a quote to reflect how we arrived at solving this problem, which basically states the greatest disease in the world today is not TB or cancer, it is being unwanted and being uncared for. So our mission was to provide low-cost medical care while also reducing the strain on the healthcare system due to a shortage of doctors in hospitals. This is despite the fact that we have a very high number of doctors who are qualified at providing medical care who are unplaced by the health department. So our vision is to create a platform whereby we can invite currently unplaced, board certified by the HPCA to provide consultations to patients on our platform. So this is the current statistics in South Africa at the moment. At the private sector, we have a ratio of 1 to 300, so that's 1 doctor for every 300 patients. At the public sector, we have 1 doctor treating about 2,457 patients, while there are approximately 444 certified doctors currently unemployed and unplaced. So our solution is that we create a platform whereby a patient comes in, they enter their symptoms, they are matched to a physician based on the symptoms that they just entered. The patient will now have direct access to their doctor, which they have selected, based on a rating system. The patient pays a small fee for consultation, so it's a pay per consultation type system. At the current moment in South Africa, it is allowed for doctors to charge what they feel their services is worth. Doctors on the platform will monitor patients on a daily basis, or depending on how the patient can afford to pay for consultations. This will be an efficient service because, as I mentioned before, the ratio to doctor, patient to doctor ratio in South Africa is quite high. So having a platform whereby a doctor can be caring for about 5 patients or 10 or 50 would reduce the accuracy of diagnosis. Doctors will also be able to communicate with each other through the platform. On doing research yesterday, we reached out to a doctor who suggested that they be able to reach out to each other within the platform to better diagnose patients. Our services and benefits to give care and advice, direct access to doctors via voice or chat. There will be a panic button should the patient feel like their symptoms are too great for just advice. So the panic button will send an alert to emergency services and it will geolocate you and send them to your location. Remote monitoring allows us to track illnesses. It allows us to make efficient patient care. Public hospitals will benefit also because it will reduce the strain on them. This will be a pay-per-consultation service, as we mentioned, of which we will take a small fee. But the main goal of this, as we reach a critical mass of users, we will be able to map out infections and illnesses, and that is variable data to pharmaceutical industry, to the healthcare industry, which will work on early prevention and detection of illnesses. And we will sell ads to pharmaceuticals, which will allow us to generate some revenue. So these were the technologies that we used. We used Android Studio for developing the app, Here Technologies for geolocation, for geo-visualization of the data, and Simwood for SMSing and sending out of emergency alerts. I'm going to take you through our app now. So on the home screen, when you log in, it will ask for your location, which you will accept to display. It will display common symptoms based on your region. So if in your area a lot of people are complaining of colds, heartburns, you will see that on the home screen, and you will be able to.
And it's time.
One was why are there 444 medical people unemployed?
That was an approximate value based on the current statistics in the country. According to the Department of Health, this year, last year, 586 graduates were certified to be doctors in South Africa, but only 184 of them were able to be placed. So the rest, although they are certified to practice medicine, they don't have placement at hospitals.
Okay, so they haven't done their community work yet, basically. So be careful about the definition. And then, again, people doing, I guess, telemedicine again, and then ads. So, yeah.
Like I mentioned, it's not any doctor who goes there. They have to be board certified to actually be able to provide service on our app. And at the current moment, regulations in South Africa allow for that.